This is Boomer Life on CL 650.
Welcome back to Boomer Life on CL 650. I'm Joanne Sutton. In studio with us today, we have Dr. Chris Coburn from SmartShape Weight Loss Centers. Dr. Coburn is a leading expert in advanced laparoscopic surgery. Currently, he's a general surgeon at Trillium Health Center and the medical director and surgeon at the SmartShape Weight Loss Center. So he's offering the most comprehensive weight loss management programs in Canada. His expertise in advanced laparoscopic procedures includes everything from the lap band surgery, gallbladder removal, hernia repair, advanced bowel surgery, spleen. You can do it all, basically, Dr. Coburn, can't you?
Yeah, I mean, I'm a general surgeon by training, but certainly the focus and where our passion is of our clinic is in the options that SmartShape offers for effective, sustained, and significant weight loss for our patients.
Sustainable weight loss. That's definitely a buzzword. Tell us a little bit more about some of the specific programs available and choices and options to us to lose weight at SmartShape.
Sure. Well, at SmartShape, we offer 3 programs, and we emphasize the word program because none of these is just simply an operation. I think we do our best to educate patients that the surgery or the procedure is just part of what we offer. We have a comprehensive team, a multidisciplinary team of nurses and coaches and dietitians available across Canada at all of our clinics in Vancouver, in Calgary, Regina, Winnipeg, Toronto, where we do these procedures. And the 3 procedures that we offer are the lap band procedure, the gastric sleeve procedure, and the gastric balloon.
So in the first part of the program, we were talking in great detail about the lap band program. Can you tell us a little bit more about what the balloon is, what it is, how it works, and who's a good candidate for that?
Sure. Well, so the gastric balloon is a device that we place inside the stomach. There are no incisions. We simply look down into the stomach with a telescope. We inflate the balloon. We place it in the very upper part of the stomach, and we want to leave it there for 6 months. Now, the balloon has to come out after 6 months because being inside the stomach, it's exposed to the acid and the enzymes. And so
it could break down?
Yeah, so it's a temporary device. It's removed again with another procedure 6 months later. The key elements to the balloon are that it's temporary, which some people seem to think that's a great idea because they don't want something permanent. But we do emphasize that if you want permanent weight loss, you really need to look at a permanent change. The balloon is really a device that we think is best suited for typically younger people, usually women, who have a smaller amount of weight to lose. So maybe their BMI is between 27 and 35. But importantly, who've only had a weight issue for a shorter period of time. And we think if we can induce the changes of chewing well, eating slowly, smaller portions, if we can encourage our patients to make those changes, they can keep those changes in place once the balloon has been removed.
So what's the essence and the actual theory behind the balloon? Are you just is it just filling up somebody's stomach so they feel fuller quicker?
So again, very much with the other programs we have at SmartShape, the lap band, the gastric sleeve, and the balloon, they all work because at the very top of the stomach, there's a small segment that's very richly supplied with sensors or receptors that are sensitive to stretch.
Kind of like nerve endings.
Yep.
Okay.
So when somebody has a balloon in place and they take a bite of food, that food gets held up by the balloon. That little bit of stomach that's above the balloon fills and induces this sense of being satisfied. The food then travels around the balloon, goes down through the stomach and the bowel normally. So all 3 procedures of SmartShape all rely on the same basic principle, just different mechanisms to do it.
Okay, and you just mentioned that it wasn't typically suited for someone who's been struggling with a weight issue their whole life.
No, I think it's more challenging for those individuals to maintain the eating habits that the balloon induces, to maintain those eating habits once the balloon has been removed. There are some centers that will use a balloon on a temporary basis prior to maybe back surgery or heart surgery to induce some weight loss, but that's not been a big part of what we've done. We include the balloon as part of our armamentarium of options, again, for people whose needs are different.
So in essence, for lack of a better way to describe it, what I'm hearing you say is it's almost like a little bit of a kickstart program to weight loss, or a kickstart to help someone make some changes and get back on track.
Sure. Kickstart, jump, those are the phrases we commonly use with the balloon. Again, what we want to do at SmartShape is make sure that we're giving people options and educating them that all of these things that we do are tools that allow them to control their portion size more than anything else.
Okay, so what could somebody expect when they first make a consultation with SmartShape?
Right. So the first thing we would encourage people to do is to visit our website, smartshape.ca. On the website, we have an abundance of information about all the different options that we offer. Gather some information there. There are videos, there are visual aids, and then feel free to contact us. We've got a team of program advisors that can, again, discuss with the individual what may work best for them and give them the options. Let them know that these are safe and effective options to achieve this significant and sustained weight loss. And again, we have clinics across the country, private clinics where these procedures are available.
I'm just imagining for someone who has struggled with weight their entire lives that this may not be an easy issue to talk about. How does somebody come forth and say, you know what, I'm just really tired of being heavy and I'm tired of not being able to live the life that I want to, and maybe they're dealing with some level of shame or guilt or whatever it is. There's obviously other layers of issues involved.
Yeah, there's a lot of social issues involved with obesity. I commonly tell people that obesity remains the last socially acceptable prejudice that we have in society. And it's unfortunate because nobody is obese. Nobody wants to be obese. Nobody chooses that as the way they want to be. But unfortunately, we have to start thinking about obesity like we do other chronic diseases, like diabetes, like high blood pressure. These are diseases that need long-term sustainable solutions to be effective. We don't blame people in the same way. We don't consider people, it's their fault if they're diabetic, but we do with obesity, and it's a real problem. It makes people hide. They don't come out there. They stay at home. And
they go within. They hide. You have to know that obesity is not your fault. And if society can't tell you that, hopefully a doctor can.
And at SmartShape, we understand this. We're very sensitive to the particular needs of the overweight and obese individuals. And by dealing with them and talking with them in terms, dealing with success, talking about success not being the number of pounds you lose, but the way it changes your life and the new things you can do and the health benefits of weight loss. Those are what's important to us and our team.
I also think that many people might be a little intimidated by having to sort of volunteer for surgery to look after an obesity situation or a weight loss situation. They might be intimidated by that. How do you deal with those type of concerns?
Sure. But again, what we offer at SmartShape are procedures that are safe, are minimally invasive. So they typically are done either as an outpatient or in the case of the gastric sleeve, just a day or two in the hospital. These are procedures that get you back to your normal life very quickly. The weight loss is achieved over a longer period of time, but that's what you want. Rapid weight loss is not the healthiest way to lose weight.
I'm actually really happy that you mentioned gastric sleeve because that was number 3 of the 3 options from the SmartShape Weight Loss Center. Was number 1 was lap band, number 2 was the gastric balloon, and number 3 was the gastric sleeve. Tell us a little bit about the sleeve.
Sure. So the gastric sleeve procedure is, again, an operation procedure that we do laparoscopically. It involves looking inside with a little telescope and basically removing, at this point, now truly removing a significant portion of the stomach. But again, back to the same principle, leaving a little bit of stomach at the top, and the outflow from that little pouch of stomach is controlled or limited by a long, thin tube of stomach, much like the sleeve on your shirt. That's where the term sleeve comes from. The gastric sleeve is certainly a little more invasive than the lap band, but still a very safe procedure. It doesn't have any device, so there's no adjusting of the sleeve if you want. The weight loss we get tends to be more rapid initially and then slow down, as opposed to the lap band where it's a more steady weight loss. But again, at SmartShape, what we do is we offer not just the gastric sleeve procedure, but in fact a program to encourage and help people to learn how to use this tool as well. So you can see, if you look again on our website, more visual aids and so on, you'll see that the significant portion of the stomach that's removed, this is not a reversible procedure. This is something that once it's done, is permanent.
Done. You're actually changing the shape and the size of our stomach in this procedure.
Correct. We're removing a part of the stomach, the part of the stomach that, I mean, it's not critical. We still have the same function of the stomach. It still allows food to pass through to the small bowel. The digestion and absorption of nutrients, which occurs in this part of the bowel past the stomach, is unchanged. So again, like the lap band, there is no need for vitamins and supplements to overcome elements of malabsorption that we see with some of these procedures like a gastric bypass.
And is there one program that's more popular than the other, or they're just all they've all been created to provide options, and they're just suited for different types of people in different types of situations?
Yeah, I mean, they're all safe, they're all effective, and it's, I think, by working with our team, both our program advisors and then with the surgeons, we can talk to the individuals and say, what do you think works best for you? A lot of it has to do around issues of access to getting a lap band adjusted. Do you want the safest procedure? Are there health issues in particular that may be better suited to one procedure or the other? So again, I think at SmartShape, by offering a variety of options, we can help meet the needs of a greater number of people.
And a perfect candidate for the gastric sleeve
is again similar to the candidate for a lap band. Somebody with a BMI, generally for the sleeves, it's a BMI greater than 40, but 40 up to 50, 60 is no problem. Health issues like diabetes, high blood pressure, sleep apnea, arthritis, all of these health issues are important and are all benefit from significant weight loss.
And what would some of the rules involved be? Because there's rules like any type of weight loss program. Once I've had the gastric sleeve, what are some of the changes that I will have to experience?
So the changes, again, are basically identical to the balloon and the lap band procedure in that we want our patients to take small bites, chew the food well and eat slowly, and thereby be satisfied with a smaller portion of food. It's not a diet. None of these procedures involve really changing what you eat, but we want you to change the way you eat. And the more effective and the more able you are to make those changes, the better the procedures are going to work. So
I could still have a steak for dinner, ice cream for dessert, and a nice glass of wine?
Sure. I mean, that might not be the best choice. You might want to throw in some vegetables in there. But
I forgot about the broccoli. Sorry.
Yes. So, for example, for men that come to see us, we tell them that the 16-ounce porterhouse and big baked potato is going to change into a 4 or 6 ounce fillet and some salad and vegetables, and they're okay with that because they know they've got to make changes if they're going to make permanent changes in their life.
And Dr. Coburn, once again, can you remind us where your SmartShape weight loss centers are in Canada? Where can these programs and procedures take place?
Yes, again, we have 6 clinics across the country. Here in Vancouver, we have Falls Creek Surgical Center downtown, but we have clinics in Calgary, Regina, Winnipeg, as well as Toronto and Mississauga. The lap band procedure is available across the country. Gastric balloon and the gastric sleeve procedures are available basically in Ontario.
And if you want more information, of course, visit the website, smartshape.ca. And if you've ever considered talking to someone about making a significant change in your life regarding your weight, Dr. Coburn is the one to talk to. And he's got more to share in just a moment on Boomer Life on CL 650.
Canada's only weekly radio show dedicated to the baby boomer lifestyle. This is Boomer Life on CL 650.